Thank you very, very much. And thank you for inviting me to this excellent conference. And thank you, Roberta, for this kind presentation. I'm Magnus Loftsson, and I work for the NGO Friends. And I'm also working with the big conference, the World Anti-Bullying Forum, in this field. And my topic today is bullying prevention and implications for practice. And I will talk, as I am a licensed psychologist, I will also talk about bullying and health in different ways. Last week, the biggest newspaper, Today's News in Sweden, had a debate with the title, "The Education System Can Explain the High Mortality Rate of Young People." And as two researchers point out, Sweden has become one of the countries in Western Europe with the highest mortality rate among young people between 20 to 34 years. And that's really sad news. And they analyze this situation and call it this deaths of despair, since it involves suicide, death in traffic accidents, and drug overdoses to a huge extent. And what they find as causes for this deaths of despair is increased number of learners, students without approved grades from compulsory school. And recently, there is about 14% of students in Sweden that does not get neither their theoretical or vocational education that can lead to later employment. So this group of children that fails in the school system, or the school system is failing to learn that what they need in order to secure a job, has a very, very high risk of this kind of deaths of despair. And that is indeed a problem when it comes to psychological health and mental health. Another disturbing change is that the prevalence of bullying, if you look at it on the trend on long term, is also going on the wrong direction. We have used this same instrument, as I know that Lithuania and other Nordic countries, so the whole West Europe also uses, together with Canada, health behavior in school-age children. And if you look at the green dots here with the green line, you can see that Sweden was in a kind of good conditions between 2000 and has worsened their condition a bit in the late since 2014. And maybe someone is thinking, oh, this is really a lot of children. And that's the reason to that is because I have taken together bullied children who report that they have been bullied frequently, and children who report that they haven't been bullied as frequently, less frequently. So everybody who has some kind of bullying experience and is exposed to bullying has been included in these numbers. And we can also see from the Swedish National Authority for Education that their numbers also, when you include all experiences of bullying, has increased a lot during the latest years. And this is especially true for children between 11 and 15 years, grade 9, and also grade 4, 5, and 6. And we don't know as much about cyberbullying when it comes to trend data, because the question has changed over time, and we haven't followed that for this whole historical period, for obvious reasons, since cell phones was introduced maybe in 2009, 2010. And as you can see, that has also risen. So we know now in Sweden that about every fourth child, like around 25%, is exposed to bullying online or in school, or the combination of these two. So that is kind of disturbing. And as Morten also was saying, we can see this when it comes to safety in school. The situation for children in grade 9 has also become less good the latest years, the latest decade. So it's trends that is kind of small in a way, but they are important to take serious also. So that I think is the combination, like children who failed in school, or the school system failed to give children the right to education, and also children who experience bullying and other forms of violences in school or online, is two very big threats to children's mental health. And we do know also that when it comes to consequences of bullying victimization, that has been a research field that's been, it's huge. And these scholars has done meta-analysis. They have collected a lot of data to see what is the evidence around consequences of bullying victimization. And they say there is a convincing evidence of a causality, and that's not usual for researchers to say. Very often there's like association between exposure to bullying, but they even talk about the causal association between exposure to bullying victimization in children and adolescents and adverse health outcomes, including anxiety, depression, poor mental health, poor general health, non-suicidal self-injury, and suicidal ideation, thinking about taking your life or not wanting to live. That's the thoughts you can have, and also suicide attempts. So I think that is very, very clear that bullying causes severe mental health problems, especially among children who has been exposed frequently and over time, and also if they are exposed in several arenas, like both in school and online, they suffer even worse health consequences. Okay, so I think I also want to point out a little bit of the solutions. The Public Health Agency did a literature review in Sweden, because that was also a reaction on how can we work with mental health among children, because we also know that is on the rise, the problems with mental health. And also, as the Education Minister Anna Ekström was saying, we know it especially during the corona pandemic, when people has been isolated in a way because of the restrictions, this have even got worse. So what is most important to do in schools? And we can see from research that social support from teachers is the really important thing, and also preventing bullying in schools are important for mental health. Those two factors, and children need to have some kind of school connectedness. That school as a place is a place where you want to go. You're connected to the school, and also academic performance is really protecting when it comes to mental health problems. They also see from research that teaching children about mental health can reduce mental health problems. So I think these three things is like key to what you need to do in order to improve the situation. Teachers are very important, bullying prevention, feeling connection to the school, and also academic performance. And having mental health prevention as part of the curricula. The UN Institution for Education, UNESCO, have gathered researchers and practitioners in the field. The World Anti-Bullying Forum has been part of this work also, to find like what is the best practice to prevent bullying? What do a country need? And how can you use the whole education system to prevent bullying and cyberbullying? And there's need to be a strong political leadership, a robust legal and policy framework, like Anna and Morten were describing in the beginning. I sometimes really also long for a framework where we are mentioning bullying more in Sweden. We have this concept of offensive or degrading treatment, as Morten was talking about. But I think also if you look at Norwegian law or Finnish law or Lithuanian law, bullying is also in the school law, but that we don't have that in Sweden actually. And to also put in the wider framework of violence against children according to the Convention of the Right of the Child. The Convention of the Right of the Child was a law in Sweden last year, but I think there's still implementation work to do to make that more robust in the legal framework. It's also very important with training and support for teachers. Teachers doesn't feel that they have enough with knowledge and enough with training during their regular teacher training, but also when it comes to their training outside, like parallel to their professional work. We need also to have a curriculum that teach and to promote caring, a more caring climate. A lot of people talk about the school climate that is caring, and I think that is very important for the connectedness to feel that school is a place where people care for me and we care for each other, and to create this safe psychological and physical school and classroom environments that children need to become great learners also. I think in Sweden we have a great reporting mechanism for students affected by bullying, like Morten was talking about, also at the school, but there is a lot of cases also where it doesn't work at all, that has to be investigated. But that is also a protective system to have that. And I think we also need to involve all stakeholders, like parents, school community, the thinking outside the education system a little bit to involve the local community in the work, sports movement, for example. And of course, I mean, students and learners are the experts of their situation. How can we empower student participation and make listen to students? What is their experience? What is the solutions? And like we're doing today, collaborate between different sectors, different partners. And I think also collecting data, monitoring the data, and see how can we improve the situation. We have great data collection in Sweden, but we don't really know like what is the causes of the increased bullying and how can we use all the data that we are actually collecting to improve practice. That is not really clear in Sweden, I think, yet, but that is also something to improve. I also just want to highlight that, like Roberta's were talking about in the beginning, that in a month, on the 1st to 3rd of November in Stockholm, we will arrange the World Anti-Bullying Forum, and that will be a hybrid conference. So you have the chance to come there also to meet face to face, but can also participate digitally if you want to. We're going to deepen the conversation about a lot of these issues like mental health and bullying prevention. I just want to say welcome to you in one way or the other. Thank you. I'm also very much looking forward to the conversation. So I will stop talking. Thank you very much for listening.